Welcome back. This month is National Child Abuse Prevention Month.
Yeah, to talk about it, we want to welcome Assistant Professor of Psychology and Human Services at Hillier College at the University of Hartford, Dr. Noel Casiano. Thanks so much for joining us today.
Thank you for having me.
So, Doctor, tell us, what are the statistics on child abuse, both nationally and here in Connecticut?
Well, nationally, the data from the United States government National Child Abuse and Neglect system showed that there were about 3.1 million cases of child abuse or neglect that were investigated. And the investigations revealed that 76% of these reports were in regards to victims of neglect, 16% were in regards to physical abuse, and 9.4% were in regards to sexually abused children. And in Connecticut, as of October 2022, the Department of Children and Families here in Connecticut reported a total of 10,465 children having some type of DCF involvement in the state. And out of that, 3,000 kids were placed in some kind of foster care placement. 42% of those kids were in non-relative foster homes. 34% of them were in relative care. And then we had about 6% of the children in placement in some kind of congregate care setting.
Yeah, those statistics, obviously, those are children, really hard to hear, certainly. What do you think is being done to keep children safe from abuse, or what's noteworthy that's being done currently?
Well, I think we're also seeing a lot of focus and attention being spent on prevention services. So nationally, we saw about 2 million children were involved in some type of preventive services across the country. And that is, what we want to see more of, being able to inform the public about what is child abuse and knowing the signs of child abuse. So as far as what is being done, I think more needs to be done as far as making sure that there are more protective factors being implemented to be able to prevent child abuse and neglect. So that's educating and having more services to be able to inform families or educate families on the importance of positive nurturing and attachment related concerns, knowledge of parenting education, and also knowing more about child and adolescent development, and also making sure that families have positive social connections and supports, and also for children to be able to have the ability to know more and be able to express how to have better social and emotional competence.
All right, all very good information. Dr. Noel Casiano, thank you for joining us this evening.
Thank you.